And that's just one of the 4 ways to save. Now through October 1st, earn 1,000 Plenty Points when you spend $30 on select P&G products. See Rite Aid.
It is 9:02 on 1490 WGCH, WGCH.com, anywhere. I'm Tony Savino. It's Thursday morning. That means it's time for Spotlight on Medicine with the good folks from Greenwich Hospital. Topic today, yawn while quality sleep matters. My guest is neurologist Dr. Samit Malhotra, who is incoming medical director of the Sleep Center at Greenwich Hospital and Sleep and Neuroscience Associates at 55 Holly Lane, Suite 210. Dr. Malhotra went to medical school at the University of Mysore, Indiana, served his internship in internal medicine at Brookdale University Hospital in Brooklyn, residency in adult neurology at SUNY Downstate in Brooklyn, fellowships at Stanford University, Montefiore Medical Center, and Albert Einstein College of Medicine, and board certified in sleep medicine and neurology. And Dr. Malhotra, good morning. Welcome. Thanks for coming in.
Good morning. Thank you for having me, Tony.
All right, great. You're the incoming medical director of the Sleep Center at Greenwich Hospital. Give us a brief overview of the types of services available at the center.
Sure. So the sleep lab at Greenwich Hospital is the state-of-the-art facility. We are quite capable of conducting a number of diagnostic studies that help us understand the quality of one's sleep. If one is diagnosed with obstructive sleep apnea, we also are capable of doing what are called titration studies, which help us find out what is the settings on the CPAP machine, the right type of mask that the patient might need, and most importantly, how a patient might react to a CPAP treatment. We are also capable of doing multiple sleep latency tests. This is the test that is required to diagnose narcolepsy. We also do MWTs, maintenance of wakefulness test. This test is used to find out how effective a treatment for narcolepsy may be. We also do specialized testing for, say, patients having sleep disorders in association with seizure disorder, or if patients have REM behavior sleep disorder where they may, have dream enactment, we can also test for that.
All right. So I read an AARP article last month about this guy that he was strapped to the nines with all these devices and everything, and said, "Okay, now go to sleep." So how are patients? Is that what happens? How are patients diagnosed and treated at the sleep center?
Right. So it is, in fact, at the end of the day, a test. So there are definitely going to be, electrodes that we are requiring to have on the patient in order to, test for brainwave activity, breathing disorders, so on and so forth. So the basis behind this is that if you do not, of course, put these electrodes, you can't get the information that you need. So yes, there are going to be electrodes that will, be, on the patient's body, but if one is going to be able to sleep, if you have the pressure to sleep, you will sleep no matter what. So that's what we kind of rely on. And quite frankly, the data that we are looking for, if we get about 4 hours of sleep data, we are able to make a diagnosis.
Okay, that's straight sleep or 4 hours altogether?
Even if it's interrupted.
Right.
But you see, oftentimes when patients have a sleep disorder, the sleep is going to be interrupted. But we are looking for a 4 hours of recording time with some sleep in there that might be able to give us the information we need to make an accurate diagnosis.
Okay, so you have a bed in there with a pillow, you say turn out the lights and we'll see in the morning. Is that how it kind of works?
Well, actually, it's an attended study. That's an in-lab study. So what happens is, although it is called a sleep lab, it's actually like a hotel room, right? So you're spending a night in a hotel room. You do, of course, get all these electrodes on your body, and then you're being video monitored. So there is somebody who is monitoring you all night, making sure that no electrode falls off. You are comfortable in case you want to get up and get out of bed. You can always do that. So it's not that you are left, to be on your own. There is somebody always observing you.
Okay, how do people come through that? Do you find that most people are okay with it in terms of being able to sleep somewhat normally?
Yes, in fact, that is the case. So although patients tend to have this apprehension that they may not be able to sleep in a sleep lab, the fact of the matter is that they, in fact, are able to sleep pretty good.
Okay. Now, people often talk about wanting to get a good night's sleep, but how many hours of sleep do we need, and does that number change as we age?
That is an excellent question, and I get this question all the time. So there is actually no magic number. The National Sleep Foundation has actually mentioned or suggested that adult patients can actually, or individuals can get 7 to 9 hours of sleep. Right, but that's just a ballpark figure. If you get 6 hours of sleep and you do well the next day, that's okay. If you get 10 hours of sleep and you don't have any consequences the next day, you're okay too, right? So 7 to 9 hours is just a ballpark figure. But we should not forget that although the quantity is important, we should not forget the importance of quality of good quality sleep. So if somebody has a sleep disorder and is sleeping 7 hours, during the night, but is sleepy, fatigued, is not able to be productive either at school or at work the next day, then clearly that number isn't good enough for that person.
And do we know that?
Absolutely.
We can sit and say, I guess I'm not getting enough sleep or enough quality sleep, right?
Yes. So if you wake up the next morning, now one of the things that one has to kind of consider is that how do you know whether you have a sleep disorder, right? So I usually look at it from an economic standpoint, right? So if you look at the concept of, return on investment, your investment in sleep should reap the benefits of the returns of you being, alert and awake and being functional the next day. But if you are tired, you're fatigued, you're not productive the next day, obviously there's something wrong with what's happened the previous night. So that's an indicator that's something wrong may be happening.
Yeah. So why is sleep so important? What goes on with our bodies while we're sleeping?
Well, that's also a very good question. So sleep is rejuvenating. I mean, I'm sure that your listeners will agree that if they haven't had a good night's sleep, they don't really feel good the next day. That's just a personal perception. However, there's enough scientific evidence to support that if you haven't had a good quality sleep, you are prone to medical disorders, development of hypertension, diabetes, irregular heart rhythms, strokes. Mood disorders, depression is also associated with poor quality sleep.
Mm-hmm. Now, is there a reset of the body also? I've heard that happens, and there's the idea of lactic acid and built up in muscles, that kind of thing. That also happens?
Correct. So the other functions. I mean, it's fair to say that there are numerous functions that occur during sleep: memory consolidation, memory recall. In kids, there's the growth hormone release during slow wave sleep, which is responsible for, of course, them growing. So there's a bunch of metabolic, processes that are happening during sleep, which is very, very important.
Okay. My guest is Dr. Samit Malhotra, neurologist, incoming medical director of the Sleep Center at Greenwich Hospital. Have you started yet?
I haven't actually. Well, I'm at Greenwich Hospital. I'm going to be starting soon, but the practice is going to be opening, in the next week.
Okay, good. And that's our guest, Jan. While quality sleep matters, something we can all take to heart, and we're going to take a break. Come back with more on Spotlight on Medicine here on 1490 WGCH, WGCH.com, anywhere.
You make lots of important decisions for your family, but when it comes to healthcare, there's nothing more important than the doctors that you choose. So how do you make the right decision? Here's a tip. Check out the doctor's credentials and make sure they're from respected medical schools. And here's another tip. Look for a doctor who's affiliated with a truly fine hospital, like Greenwich Hospital. Greenwich Hospital is consistently rated in the top 1% nationwide for patient satisfaction. It has a broad array of specialties, from excellent women's services and breast care to pediatrics, orthopedics, extensive cancer care, and much more. Greenwich Hospital physicians meet the highest standards for healthcare excellence. For a referral to a Greenwich Hospital physician, call 203-863-3627. That's 203-863-3627. Greenwich Hospital, for the quality care you and your family deserve.
It is 9:11 here on 1490 WGCH, WGCH.com, anywhere. I'm Tony Savino. This is Spotlight on Medicine. Next week on Spotlight, as we open October, my guest will be registered nurse Maria Marini, Program Director of Oncology, with an oncology update at the Smilow Cancer Hospital at Greenwich Hospital. That is next Thursday, October 6th. Right now, my guest is Dr. Samit Malhotra, neurologist and the incoming medical director of the Sleep Center at Greenwich Hospital. We're talking about why quality sleep matters. Dr. Malhotra, most of us toss and turn all night. How do you know if you have a real sleep disorder?
Yeah, Tony, like I mentioned earlier, that if you feel that you haven't had a good return on your investment, that you don't feel well the next day, you don't feel alert and awake and feel tired and fatigued all day, there is a definite possibility that you might in fact have a sleep disorder. Now, one may not in fact have symptoms of abnormal sleep. So in that case, we have to investigate the patient based on other chronic medical conditions like hypertension, diabetes, irregular heart rhythms, stroke. So if somebody has any of these chronic medical conditions, the abnormal sleep may be a basis to all of that. So it's always a good idea to get it investigated.
Okay, so what are some of the common sleep disorders you treat? Most people would think of sleep apnea, but what others?
You're absolutely right. So because of my training in sleep medicine, I actually am capable or comfortable in treating all the sleep disorders actually. But you're right. Sleep apnea is one of the most common ones. We also treat insomnia. We treat restless leg syndrome. We treat narcolepsy. We treat circadian rhythm disorders that include shift work, and parasomnias, seizure disorders that are associated with sleep disorders. So the list is quite long.
Okay, now you mentioned narcolepsy. What is that and how is it treated?
So narcolepsy is a neurological condition. There are parts of the brain that are responsible for wakefulness. If these parts of the brain or this part of the brain is affected and these neurons die, the patients might in fact have trouble staying awake. So they're very sleepy during the day and are not productive either at school or at the place of work. That is narcolepsy. The manifestations are excessive daytime sleepiness. Patients can actually fall asleep and go directly into the REM stage of sleep, which is the dream stage of sleep, which is actually abnormal. That's not the way it should be. Typically, when one falls asleep, the REM cycles usually occur within 90 to 120 minutes after falling asleep. So if you're falling asleep and you're dreaming right away, you might have a problem.
Okay, so how is that treated then?
So currently, we don't actually have any cure for narcolepsy, unfortunately. But the FDA has approved medications that will help patients with narcolepsy lead near normal and productive lives.
Is there any cause for it that you know of?
So we, at this time, don't have an exact reason why this might be happening, but the current research does suggest that it may, in fact, be an autoimmune condition. So which means that the body is generating antibodies towards, certain targets in the body, and they're going and, killing the neurons in the brain, and that's why patients are becoming narcoleptics. But we're not absolutely certain that is the reason why. Now,
the chronic fatigue syndrome, is that a result of lack of sleep? How is that into the mix? How do you put that in the mix?
So chronic fatigue syndrome is one of those diagnoses that doesn't actually, you have to be able to rule everything out before you can make a diagnosis of chronic fatigue syndrome. So it oftentimes happens that patients might in fact be diagnosed with the CFS or chronic fatigue syndrome, but in fact have a sleep disorder instead. So unless you haven't ruled out a sleep disorder, it's probably not prudent to diagnose somebody with CFS.
Okay. Most of us know someone who snores. Does that mean they have sleep apnea?
There is a phrase out there, I think it's by Respironics, that says, don't ignore the snore. And I agree with that. Although it does not mean that a person who's been snoring has obstructive sleep apnea, but there's a very high likelihood of it. The reason that this should be investigated is because of the chronic medical problems that are associated with untreated obstructive sleep apnea. So if you have obstructive sleep apnea and you haven't, had that investigated, you are at a risk for developing, hypertension, diabetes, irregular heart rhythms, heart disease, strokes, and even premature death.
Now, sleep apnea, I hear a lot about people maybe overweight, that kind of thing. But for people that are not overweight, what causes it? Is it the makeup of their nasal cavity? I mean, how does all that work?
That's a really good question. So, although most of the people will think that you have to be overweight to have obstructive sleep apnea, that in fact is not true. It really depends on the airway. So the airway is a hollow tube between two bony prominences. ellipses, right? So it's the jaw in the front and the spine in the back. Now, if the jaw is pushed back, that results in the airway becoming narrow. Now, as long as you're awake and alert, the airway is wide open. But once you fall asleep, you have to have the anatomy, a good anatomy, to keep that airway open. But if that anatomy is poor, and you have a narrow airway to begin with, that airway will collapse. And when it collapses, that is obstructive sleep apnea.
Okay, so you could actually diagnose somebody without even having them sleep if you just look at their anatomy. Is that right?
That is actually not true. The reason being that I've had patients who are, morbidly obese, right, and do not have obstructive sleep apnea. And then I've had patients who are, in fact, when I was in training, we had a supermodel, right, who was perfect in every way or form, but she had obstructive sleep apnea.
Right, okay. That must have been a blow to her ego, right? Okay, so now your research include investigating sleep disorders, sleep disordered breathing as a risk factor for stroke. You mentioned that. So what's the connection then?
Oh, it's a very good question. Now, I mentioned earlier that obstructive sleep apnea may predispose somebody to, hypertension, diabetes, heart disease, irregular heart rhythms. All of these are actually risk factors for a stroke as well. Now, when somebody has obstructive sleep apnea, it predisposes them to atrial fibrillation, which is the irregular heart rhythm. That increases one's risk for stroke nearly 5 times. So the connection is obvious. If somebody has obstructive sleep apnea, they have atrial fibrillation as a consequence of that. They might in fact have a stroke as a consequence of the atrial fibrillation. Mm-hmm. There's also evidence that supports that when patients who had undergone a treatment for atrial fibrillation with ablation, they had a recurrence of the atrial fibrillation. That means the atrial fibrillation came back because their sleep apnea was not treated. And this was up to 82% of patients.
Wow. Now, so what other health consequences are associated with sleep disorders?
So there are many. Chronic medical conditions, like I mentioned, one of the leading causes of hypertension in the country is obstructive sleep apnea. American Academy of Endocrinology suggests that anybody who is a newly diagnosed diabetic over the age of 50 and a male should be a sleep disorder should be looked for. So there are definitely a bunch of medical problems, irregular heart rhythms, all sorts of arrhythmias that can happen as a consequence of abnormal quality sleep.
All right. And by the way, if you want to find out more about this, it's a fascinating subject to me. Dr. Malhotra will be giving an introduction to quality sleep on Wednesday, October 19th from noon till 1 at the Noble Conference Center at Greenwich Hospital. You can call 888-305-9253 or go to greenwichhospital.org/events, and it's free. And what will you be talking about there?
Well, I'll be talking about the importance of quality sleep, but I also wanted to add here that, we're setting up a website. It's www.sleepwellmd.com, and that actually it should be up and running in the next, week or so, has extensive information about the consequences of poor quality sleep. So if your listeners want to actually, go there to that website, they'll actually get a lot of information about poor quality sleep there.
All right, we're going to take another break with Dr. Samit Malhotra speaking about why quality sleep matters here on Spotlight on Medicine, 1490 WGCH, WGCH.com, anywhere. I'm Tony Savino. Stay with us.
Want an easy way to find a great doctor? Got a health issue you'd like to research? Looking for ways to be healthier and better informed about personal wellness? You'll find all this and more at the Greenwich Hospital website, www.greenhosp.org. This richly detailed website is loaded with valuable information. You'll find everything from directions and visiting hours to details about all the medical services and staff physicians, including doctors' credentials and office locations. You'll also find listings of community healthcare events, support groups, and much, much more. Whether you're planning a hospital visit or just want to be a more informed healthcare consumer, the place to start is Greenwich Hospital's website. Find it at www.greenhosp.org. That's www.greenhosp.org. Check it out today and get wise about health.
9:21 here on 1490 WGCH, WGCH.com, anywhere. About 10 more minutes with Dr. Samit Malhotra, neurologist and incoming medical director of the Sleep Center at Greenwich Hospital. And We'll turn things over then to the Experience Pros radio show at 9:30, and of course Debbie Nigro at 10. And Dr. Malhotra, many older adults complain they can't sleep at night. Is insomnia a natural part of aging?
So the answer to that question is actually no. It is true that sleep needs change as we age, but if you look at how the seniors sleep, they don't sleep in one consolidated sleep cycle. They eventually end up getting about 7 to 9 hours of sleep, broken into different bits and pieces over a 24-hour period. So the number of hours that they actually get is about the same as a healthy young adult. But because it's broken into different pieces or parts, one might think that they have insomnia. So they don't actually have insomnia. Another factor to keep in mind is that as we get older, we are also prone to other chronic medical conditions. And sometimes the effect of those medical conditions or the medications that are used to treat these medical conditions may in fact they might impair your ability to sleep at night.
Right. If you're having pain or you have to go to the bathroom a lot, things like that.
Right.
Now, let me ask you a question, because you mentioned that breakup of sleep. I mean, is taking a 2-hour nap in the afternoon and getting 5 hours at night, is that the same as getting 7 hours? Is it cumulative like that?
It is acceptable for for the seniors to actually do that. Right, but as a young, healthy adult, if you have to go to work, you can actually, take those 2-hour nap in the daytime. So, yeah, as long as you
try, but yeah.
True. So as long as you're getting those 7 to 9 hours, again, I don't want to emphasize too much on that number because it can vary. But yes, if you can get the amount of sleep that you need and feel rested or refreshed when you wake up and feel productive, the next day, you're okay.
Because I'm thinking also of cultural things. For example, the siesta in Mexico and other countries. I was in Greece. They close down things for an hour or a couple hours in the afternoon. Maybe people go home and take a nap. I don't know.
That's absolutely true. Now, the reason that happens is because if you look at the body's circadian clock, there are actually a couple of dips in that circadian rhythm. And one of the dip, which basically means that we don't have the alertness as we should, is roughly around noon. And the other one is actually between 2 a.m. and 6 a.m., right? Mm-hmm. So that's why, patients or people in Europe, right, still follow what their body is telling them, that, take a nap at the time of the day when you are not as alert. On the other side is that you are also suggested not to drive during those 2 a.m. to 6 a.m., that is because you are not going to be at, the highest, you're not going to be very alert at that time.
Right, and that's another thing that they've mentioned is that drowsy sleep can be as bad as drowsy driving, like drunken driving, correct?
Absolutely. So if you, in fact, or anybody has, obstructive sleep apnea, they are actually putting themselves and the people on the road at risk because falling asleep behind the wheel is very, very common. That's why if you are a commercial driver, your CDL has to be renewed every year. One of the things that they're required to do is actually see a medical professional, especially a sleep professional, and be investigated for sleep disorder. And we are quite capable of doing that at Greenwich Hospital as well.
All right, good. Now, we were talking about seniors a moment ago. Let's talk about children. It's true. Is it true some children diagnosed with hyperactivity or ADHD might actually be suffering from a lack of sleep? Does lack of sleep manifest itself differently in children than in adults?
That's a very, very astute observation. Adults may be sleepy and fatigued as a consequence of poor quality sleep. Children, on the other hand, can be fidgety and restless and are oftentimes misdiagnosed as having ADHD and put on medications. So I don't say that the diagnosis of ADHD does not exist, but what I say is that I recommend is that if you are suspecting ADHD, it's always a good idea to have a sleep disorder ruled out.
All right, let's talk about people with odd hours, graveyard shift. Are they more prone to developing sleep disorders? And if so, what problems may they encounter and how can they cope if they can't change jobs?
So people who work odd hours may have a sleep disorder of the circadian rhythm, which is shift work sleep disorder. the shift work is actually associated with development of cardiovascular diseases. It's also, patients may have gastrointestinal disorders like development of ulcers as a consequence of this. Studies have also showed that patients who work shifts might also have a propensity towards being infertile. So these are medical problems that are associated with working shifts, primarily because, the body is trained to follow a certain sleep and awake rhythm. And when one works shift, you're actually going against the body's clock. And so it doesn't come without consequences. Now, your question was, what can we do, to avoid the consequences? Well, there isn't really a good answer, but when somebody does a shift work, the worst thing that you can do is do rotating shifts. So what I would suggest is that if you have to do a certain shift, make sure that you keep your sleep and awake cycle the same, consistent throughout the week, irrespective of whether you are working or it's your day off.
Wow, so if you have your day off, you stay up all night.
Well, that's unfortunately the way it is, because
right,
what's happening is that the brain is now programmed to believing that if you're working, say, 8 p.m. to 8 a.m., that is day for you, right? And sleeping from 9 a.m. to 5 p.m. is night for you. Now, if you do that 5 days a week, and then you try to switch it, to regular hours on, say, Saturday and Sunday, that doesn't work because it confuses the brain. And now it has to start, to correcting itself over and over again every time you actually change that clock. So it's not advisable. I know it's not the ideal suggestion, but it's the best one that one can get or give in the situation.
Okay. Can you give us some tips about getting a good night's sleep in terms of temperature of the room, devices you shouldn't be on, that kind of thing?
Sure.
What time to go to bed?
Yeah. So, we normally don't suggest patients that they should go to bed at a certain time. That's usually not a recommendation a sleep physician makes. They do, however, say that you should anchor your wake-up time. Because if you anchor your wake-up time, you are automatically, the body is going to force you to go to bed at a certain time at night. Now, when you are preparing to go to bed, you should actually, you should prepare in a way that you have turned off all your electronics, maybe several hours before. If you can, avoid, and this is again a matter of debate. Some people say that you should not be, exercising, vigorously right before bed because it can be stimulating. The others say that it actually calms you down. So you got to listen to your body, what you think is best for you. Loose clothes, right, and a slightly cool temperature always helps patients sleep better.
Okay,
or people sleep better.
What about a warm glass of milk? Does that work? I mean, you hear about that all the time.
If it works for you, go ahead and do it.
So there's some leeway in here. It depends. It's like your own body, correct?
Absolutely, you got to listen to your own body and do what you think is right. But if you feel that you are having or you have consequences of poor quality sleep, I urge you not to ignore it.
Okay, how can someone find out more about the Sleep Center at Greenwich Hospital, where you're the incoming medical director?
So, going on the internet and looking up the Greenwich Hospital, website is actually one of the easiest way to do it. But also one can call the number 203-863-3167 at the Greenwich Hospital and get information from Julie. Or one can call my practice at 203-422-7940 and get information from there. Now, either we'll be able to give you the answers that you're asking or looking for, or direct you to somebody who can.
All right, good. And if you want to find out more about this always fascinating topic to me anyway, next, I'm sure not next Wednesday, but Wednesday, October 19th from noon till 1 in the Noble Conference Center at Greenwich Hospital, get to meet Dr. Samit Malhotra as he will be talking about the introduction to quality sleep. Again, Wednesday, October 19th, noon to 1. To register, call 888-305-9253 or go to greenwichhospital.org/events, and it is free. Dr. Malhotra, the incoming medical director of the Sleep Center at Greenwich Hospital, welcome aboard. Thanks for joining me today.
Thank you for having me.
Next week on Spotlight on Medicine, we'll get an oncology update, Smilow Cancer Center Hospital at Greenwich Hospital with registered nurse Maria Marini, Program Director of Oncology at the hospital. I'm Tony Savino. Thanks for joining us on Spotlight on Medicine. Stay tuned. Experience Pros radio show next on 1490 WGCH and WGCH.com anywhere.